Total hip replacement surgery can greatly improve quality of life, but it's not without risk. Dislocation, limb length inequality, premature wear, and even malfunction of the prosthetic are possible outcomes and generally require revision surgery. Accurate placement of the acetabular cup is a crucial variable in total hip replacement surgery, and since most procedures are performed using eyeball judgment, sometimes cup placement is a best guess. TekA Orthopaedics has developed a system that eliminates the guesswork in total hip replacement surgery. Our anterior patient clamp device with force and pelvic plane monitoring is a non-invasive device that continuously monitors the patient's pelvic plane. Even if the patient's position is adjusted, TekA's system tracks orientation and position in real time. Sensor attachments provide real-time orientation and position feedback for reaming and impacting tools and ensure tools are positioned accurately relative to the patient's anatomy in real time. This gives the surgeon live guidance to precisely ream the acetabulum and locate the acetabular cup precisely. TekA's advanced software systems are simple to configure as part of the surgical plan, allowing the surgeon to set critical variables pre-op and adjust them to meet the patient's anatomy during the procedure. The surgeon simply follows the targets on the display to accurately locate and angle the tools, always relative to the patient's pelvic plane. Setup screens are intuitive, simplifying the setup procedure. In theatre, the system is simple to use. The surgeon only needs to get the ball into the target zone to be confident that the reaming and cup placement are accurate. Most surgeons adapt to the motion and targeting system in under 90 seconds. Position data is recorded throughout the procedure and logged for later analysis and verification. This information is not only valuable to the surgeon, prosthetic manufacturers and hospitals can also harness this data to monitor outcomes, provide training, and refine procedures. The total hip replacement market is estimated to reach a value of $7.1 billion by 2019. TekA has developed an alignment device and system for total hip replacement surgery that delivers significant patient benefits. Relative to other systems, TekA's device is non-invasive, simple to operate, and low cost to produce. For investment opportunities in TekA's game-changing technology, contact us at www.tekaorthopaedics.com.au.